Tonight's webinar will be on Patient Care Vice President. My name is Jeffrey Van Loo, and I'm one of the APhA-ASP National Members at Large. My email is there for you on the screen if you have any questions following this webinar or at any time throughout the year. Feel free to reach out to me with any questions you may have. So now, just for some housekeeping before we begin, everyone is currently in listen-only mode. You may listen in through the phone, but you will need the phone number and access code. If you're on the phone, please mute yourself in order to avoid any background noise that may be disruptive to the speakers tonight. So at the end of the webinar, in order to ask a question, please use the raise hand button and the organizer will unmute you so that you are able to ask your question. Or throughout the webinar, you do have the opportunity to ask questions in the chat, and Samantha Lewis of the Education Standing Committee will be organizing them throughout the webinar, and we will get to all of your questions at the end of the webinar during the question and answer portion. So to start out tonight, we have a poll question for you just to get an idea of who's joining us on the webinar. So the poll question is, what is your role in your APhA-ASP chapter? Are you the chapter president or president-elect, the patient care vice president, a patient care committee member, a general member, or other? So a poll should be popping up on your screens now. Please feel free to answer that. I'll give you about 10 seconds. About 5 more seconds. Okay, and Candace, if you wanted to show the results of that poll. Great, so it looks like a majority of our attendees tonight are patient care vice presidents, followed by president or vice president or president-elect. So it's great. Everyone on the webinar tonight will get great information about your chapter and about the different patient care projects and programs of APhA. So you'll all find this webinar very, very important and helpful for you throughout the year. So next we will move on to our agenda for the evening. So tonight we are going to talk about the different APhA ASP projects, patient care projects and community outreach programs, the different roles and responsibilities in your role as the patient care vice president, resources that you have and can utilize throughout the year, reporting and awards, and then tips and tricks for your position for the year. So first we're going to get into the APhA ASP projects and programs. So as a chapter leader, it's important to know why we have and participate in APhA ASP projects and programs. This year, APhA ASP National President Lucy West has encouraged student pharmacists to live your why. And patient care projects are a great way that you can start encouraging your members to live their why or even discover their why. Patient care projects can help student pharmacists find their passion, develop skills, and apply their knowledge from the classroom to better the life in your community. Throughout your participation, you're also advocating for your profession. And now that we know how the patient care projects can help you live your why, let's go through and discuss the APhA ASP patient care projects and community outreach programs. OTC Literacy is a program supported by McNeil Consumer Healthcare and Scholastic, with the goal of educating 5th and 6th grade students about over-the-counter medication safety. You may also find it beneficial to hold programming for families, teachers, community leaders, and other healthcare professionals. And by reaching these other populations, you can encourage safe and appropriate over-the-counter medication use. Programming may include how to read medication directions, follow label directions, properly measure medications, safely store medications, and consulting parents and caregivers before administering medications. You may be wondering why we are specifically targeting 5th and 6th grade students, and that's because research shows that children begin to self-medicate around 11 years old. If they're not equipped with the knowledge and information to make safe choices, then adolescents may end up doing more harm than good. So our second poll question for the night is, does your APhA-ASP chapter already have a plan to implement OTC literacy this year? open that poll up for you guys. Go ahead, I'll give you about 10 seconds to respond. Five more seconds. Okay, and we will close the poll. Great, this is really great. So it looks like 57, or a majority of the respondents, already have a plan to implement OTC literacy at their chapter, and 27 are a little unsure. So OTC literacy was launched this summer at the Summer Leadership Institute. So your chapter leaders were introduced to this program this summer. And if your chapter has any questions about the implementation, please feel free to email anyone on the Education Standing Committee, and we would be glad to help and provide ideas on how you can do so at your chapter. Jenny, the Education Standing Committee Vice Chair, will also be discussing how to access the OTC literacy page on pharmacist.com later in the webinar. So now we'll move on to Generation RX, our second community outreach program. It's a very popular program and sponsored by Cardinal Health Foundation. So medication misuse and abuse is a growing epidemic and is a concern for all age groups. Generation RX works to combat the misuse and abuse of prescription medication. This takes place through a lot of educational intervention. There is no screening process, so it's a great way to get involved no matter what year as a student pharmacist. Our oldest patient care project is sponsored by Albertsons and Safeway, and it was created with the goal to raise public awareness about the importance of immunizations and increase the number of people receiving immunizations. Student pharmacists can participate in immunizations when possible, and if you cannot, you can partner with other healthcare providers, whether that be nurses or doctors, and use that opportunity to educate the public. Now we have Operation Heart, which is sponsored by Walgreens. This program helps student pharmacists raise awareness of cardiovascular disease and its risk factors. It helps to provide patients with prevention strategies for reducing risk and promotes the profession of pharmacy and the role pharmacists have in the prevention and management of cardiovascular disease through blood pressure screening, cholesterol screenings, tobacco cessation, and diet and lifestyle modifications. So there really is a lot of great opportunities through Operation Heart to get involved with the management of your patient's care through the events that you have at your chapter. Operation Diabetes is sponsored by Rite Aid, and this helps student pharmacists to identify individuals in their community with previous undiagnosed diabetes and those currently at risk for developing diabetes. So through Operation Heart, you can participate in glucose screenings, work with a variety of healthcare providers, help patients identify the risk, and make modifications in their lifestyle. And just so you know, Diabetes Awareness Month is in the month of November, which is right after American Pharmacist Month. So it's a great way for you to capitalize on the impact that you can have on your patients in regards to their diabetes care. So now that you know all about the patient care project, let's talk more about your roles and responsibilities as patient care vice presidents at your chapter. Your first responsibility is familiarity. Have a good understanding of all of the projects and programs we just went through, and also be aware of the resources available for you and the relationships related to your chapter, related to them in your chapter. Organization is another big one of your chairs and events that you have throughout the year. Communication is essential to be successful, and it's up to you to make sure that you do so effectively with your chairs, executive board, members, chapter advisors, and community. Relationships. I cannot stress enough how important these are with other students, organizations, chapter members, faculty and staff, community pharmacists. All of these people are at the core of your patient care projects. Documentation and reporting. If you were at the annual meeting and attended the awards celebration, you know how exciting the awards process can be, and that all starts with reporting. Last but certainly not least is recruitment. Recruitment is essential to find motivated community members and leaders. So now let's go a little bit deeper into familiarity. So again, this is going to be your general APhA-ASP knowledge and includes the projects and programs that we went through and the communication style guide, which includes correct terminology that we would prefer you use when working in the community. For example, we do not like the usage of P1. Instead, we prefer that you use first-year student pharmacist. Also, always use APhA-ASP, no lone ASPs. Additionally, you want to be familiar with all the resources available for you, and there are a lot. But don't worry, Jenny Levine of the Education Standing Committee will be going through most of them in the next few slides. So, but as far as Academy leadership goes, with regional officers, your Education Standing Committee, and National Executive Committee, you have a big team behind you, and we're here to help you throughout the way. And we'd love to hear about all the great success that you're having at your chapters. So now we will come to the Education Standing Committee Vice Chair, Jenny Levine, from the University of North Carolina at Chapel Hill, to talk more about the resources available to you. Jenny?
Thank you, Jeffrey. So hi, everyone. Thank you for having me tonight all the way from Malawi. Where here it's actually past 2 in the morning, so excuse me if I'm sounding a little tired. So now that Jeffrey has introduced them, I'm going to be diving a little bit deeper into the resources available to you and your chapters. So hopefully you all have visited pharmacist.com before, but if you have not, we're just going to look at how you're going to access the resources you'll need. So first you'll start by going to pharmacist.com/APhA-ASP, and from that page is where you can access a lot of information. So what we're going to be talking about is if you scroll down and you click on APhA-ASP projects and programs. So that will bring you to this page, and from here you will select from the projects and programs listed. The link to OTC literacy should become available very soon. So once you've clicked on your project or program, you can read through the overview about the project and some statistics about the history, and underneath that your screen should look like this. And this is the planning guide for Operation Diabetes, and these planning guides are actually updated by the National Education Standing Committee each year so that they contain the most up-to-date information, and they should be very useful to you and your chapters. So starting off in the overview section, it gives an introduction to the project. Underneath that, you can find information for your chapter advisors, as well as an educational section that is especially useful for your first-year student pharmacists. But it's also a good refresher for more experienced students, as this one for Operation Diabetes goes over diagnostic criteria, dietary guidelines, risk factors, and more. So this resource will help your chapter members feel more prepared to volunteer at events. If you look down under Resources, you can find steps and tips for planning an event, and here you can also find how to promote events to the public and through the media. There's tips for how to write a public service announcement, a pitch letter, how to be interviewed by a reporter, and there's also sample documents that you can model your promotional materials after so that you don't have to write anything from scratch. You can also find forms for documenting event information that's actually useful for reporting, and then patient forms that are useful for screening events. Under support tools, there's a wealth of information related to therapeutics, supplies, and guidelines. And I know I just went over a lot. These are all great resources. However, you're also welcome to come up with your own materials, and we really encourage that. We want you to feel free to get creative. So please take the time to go through these on your own time and make sure your project leaders are also aware of these. So if you look down even further, under online resources, you can find links to websites that will supplement the planning guide. So for example, here you can see a link to the American Diabetes Association as well as others. And even further down you see reporting guidelines, and these are specifically created for each project and program, and they're separate from the Chapter Achievement Award reporting guidelines. Jeffrey's going to go into this in depth later in the webinar. So going back to the pharmacist.com APhA-ASP page, if you click on the chapter office resources, you will bring up this page. So under chapter operations, you can see the communication style guide. And under this, you'll find how you should refer to different things in APhA-ASP, such as we always use the term student pharmacist, never pharmacy student, and so on. So please make sure you read through this as you proceed to plan for the upcoming year. So hopefully you will all have the opportunity to attend your mid-year regional meeting this year. At MRM, you have the opportunity to attend the chapter leadership workshop. And at this, you can network with students and leaders from other chapters. You'll be able to share ideas and take home new ideas to implement at your chapters. Also at MRM, there is a Generation RX workshop, which is an opportunity for your chapter members to learn more about this community outreach program. And students can also share ideas about successful events that they've had at their chapters. So new at MRM this year, we were going to have a OTC literacy workshop, and at this we'll be educating student pharmacists about this new initiative. It'll also give the opportunity for chapters to share what they've already done with OTC literacy and share ideas for future events. So I hope you guys can make it out to your MRMs this year. So at the annual meeting this year, it's going to be in March in Baltimore, Maryland. You can look forward to specific patient care project workshops. So these are 1-hour workshops where you can discuss specifics for each project and program, such as innovative ideas, potential collaborations, and you'll also always have the opportunity to network with other chapter leaders and members. So I encourage you to make sure that you all have a representative from your chapter at each workshop so you can bring the ideas back to your chapters. And as you're networking, remember to meet your champ teams. So also at the annual meeting are workshops for each chapter leadership position. So for you guys, you can look forward to the Patient Care Vice President workshop, where you or your incoming Patient Care Vice President can meet and network with other Patient Care Vice Presidents. And you'll learn about the position and resources available to you. So as leaders within APhA-ASP, you should all be aware of the communication avenues that exist. So first, we have social media. If you are not already, make sure you have liked or followed us on Facebook, Twitter, and Instagram. Through these, you'll be kept up to date with dates and deadlines, pharmacy-related current events, and you'll be able to see highlights from chapters around the country. So you'll really stay connected if you follow us on social media. Finally, as members of APhA-ASP, you are all subscribed to Student Pharmacist magazine. This is another great opportunity to see what other chapters are doing, read articles written by other student pharmacists, new practitioners, and pharmacists. Look out for these in the mail and make sure your chapter members are aware of this great resource. So I want to thank you for having me this evening. Please don't hesitate to reach out to the Education Standing Committee at any time. You can find our contact information on pharmacist.com, but Jeffrey's also going to share it later in the presentation. We look forward to reading and hearing about your successes this year. So I'll go ahead and turn it back over to Jeffrey.
Thank you so much, Jenny. So going on with the different roles and responsibilities of Patient Care Vice President, when it comes to organization, you want to make sure that you have a good selection in programs at your chapter. We understand that not everyone has the resources to do all of the projects all of the time, and we want to make sure that you are focusing on quality of the programs over quantity. So get one project up and running smoothly, and when you do this, consider the interests of your chapter members and the needs of your community. Next is structure. Your committee structure is very important, so organization will allow you to achieve more at your chapter. So I would highly suggest considering having uniformity between the different committees. Sorry, it looks like the PowerPoint went off real quick, but there it is. Okay, so logistics are essential, as well as you want to make sure that your chairs know and have what they need to set up events. Also, be sure to advertise your events to assure successful turnout for the hard work that you put in by your chairs. So utilize Facebook, listserv, word of mouth, anything you can do to get the word out about your event. Your next responsibility is recruitment. So first, find ways to excite everyone and get involved. Make sure events are meaningful and fun and really draw in student members. When it comes to your chairs, think of how you would tackle a project if you were given very detailed instruction versus given leeway on a project. When you're given ownership of a project, you tend to give it your all. You want to motivate your chairs to run with their ideas and be innovative. This is where they will thrive. Understand your members. Some will be more comfortable in larger groups, and some will be more comfortable in one-on-one patient interaction. And you want to make sure that you have a variety of events, hit all of the different comfort levels, and get all of your members involved. Levels of knowledge. Obviously, your first year and final year student pharmacists are going to have different knowledge bases, and you want to make sure to appeal to all your members. So your first year student pharmacists, make sure that you can do some educational events like Generation RX or OTC literacy, and more patient care-focused events for your final year student pharmacists. You also want to have opportunities for members to take their involvement to the next level. So get your first years involved early, and that will also help with continuity of your event. Finally, appeal to your members' interests. If someone has an idea, see if you can make it happen. When someone has a passion or personal connection behind something and what they're doing, let them take ownership of that. Next is relationships. Again, I can't stress how important these are. Successful events require successful relationships. You want to make sure that you find community partners to work with, whether they are nonprofit organizations, local schools, or local law enforcement for drug take-back days for Generation RX. Also make sure that you reach out to faculty and staff. These are underutilized resources, and in some cases, but they are right at your fingertips. So approach your professor that teaches your OTC course and see how they can help you organize programming for OTC literacy. Alumni is a group of people that may be members of APhA or were members of APhA-ASP and still would like to be involved and help precept events. Pharmacists are great resources to help set up events for you and allow you to use their site that they work at. Also, a great relationship are other healthcare providers and other student organizations. Whether they be med school or nursing school or dental school, we really are trying to collaborate as a profession. So find ways that can benefit all organizations and parties involved. It should be a rewarding experience for both of the parties involved. So now we'll talk about awards. So there are two different separate cycles for the awards patient care projects. So the patient care projects reporting cycle is July 1st through June 30th of each year, and the reporting deadline is July 15th. These reports are separate from the chapter achievement reports, so the patient care projects have individual reports. There will be 8 regional winners recognized as the respective MRMs per patient care project and community outreach program, and 1 national winner recognized at the APhA annual meeting and exhibition. For Generation RX, it's a little different. The reporting cycle is a little different because the top 3 winning chapters send 2 representatives to the APhA Institute on Alcoholism and Drug Dependencies in June each year in Salt Lake City, Utah. So the reporting deadline for Generation RX is January 5th, and the 8 regional winners are recognized at the APhA annual meeting and exhibition. So now that we went over the awards, let's talk about the awards criteria because there are several things that we are looking for specifically. Collaboration, again, this is with other organizations in your community, on campus, and other healthcare professionals. We really want to get more people collaborating in pharmacy and healthcare in general. Participation, how many student pharmacists are participating in your event? If it's the same couple of people that are attending everything, or are you really looking to engage all of your members? How many faculty and staff, new practitioners, and pharmacists attend your event? And again, this all comes down to relationships. Originality. We really love to see how you take your current patient care projects and put your own spin on them, and create new patient care projects at your chapter and use that creativity and innovation. Outcome. How many people are you reaching, and how are you showing them what student pharmacists and pharmacists can do for them? Reporting. So with awards comes reporting. This can be daunting, so have a system. If you need to put together a chronological list for Operation Immunization, and they had 30 flu clinics throughout the first semester, you need to have a system. So some chapters use paper slips that they have to turn into certain people. Some use Google Drive. Find what way works for your chapter and your team, and hold people accountable. This will help keep track of goals throughout the year, and I promise you it will make things very easy when it comes to reporting at the end of the year. So now that we went through the roles and responsibilities of a patient care vice president, we will now hear from a current patient care vice president and a member of the National Education Standing Committee, Nicole Clay, who is from the University of Cincinnati, and they won the 2013-2014 Innovative Programming Award this year at the San Diego annual meeting. So, Nicole?
Thank you, Jeffrey, for the introduction. As he said, my name is Nicole Clay. I am a third-year student pharmacist and a member of the Education Standing Committee, and I am also my chapter's patient care vice president. I am so excited to share with you ideas on how to be a great patient care VP by planning amazing events. So first, here's a little background about our chapter's work. This past APhA Annual Expo, the University of Cincinnati won the Innovation Award. We accomplished this through the work of our past patient care VP. She used her passion for patient care and running marathons to network with a local nonprofit called Melanoma No More. With this organization, student pharmacists, medical students, dermatologists, and community members put on free skin cancer screenings in the Cincinnati area. In 2013 through 2014, we screened 600 patients, referred 300 of them to a dermatologist for follow-up, and found 18 suspected cases of melanoma. That is 18 lives that we helped save. Not only did we help with screenings, we also participated in fundraising and helped the organization raise $25,000. We also went to elementary, middle, and high schools to discuss sun safety and the importance of sunscreen. All of this was made possible because of our patient care VP. She set the framework for our interactions. She reached out to a community partner. She volunteered a lot of her time to helping them. She got students excited to work with them, and she communicated her passion for helping. This is what it means to be a patient care VP. And now I am going to discuss with you 10 pointers to planning successful and innovative events. Okay, here we go. So first of all, creativity is key. Now, when it comes to being creative, you need to think of things you're passionate about. Is it sports? Could you hand out health literature at a tailgate? Or are you interested in education? Maybe you have a teacher friend who would let you come to their class. There is no limit to what you can do and accomplish if you are passionate about it. As patient care VP, you are working closely with your patient care chairs. If your chapter has several chairs, how do you, as the patient care VP, plan to interact with them? At my chapter, we have separate patient care meetings to work out the kinks of planning meetings and recruiting volunteers, making sure our paperwork is up to date, and anything else that involves patient care. If your chapter is large enough, you can also have committees for your patient care projects. This allows the patient care chair to have practice overseeing a group of students, and these are also an interested group of students that can help them get their volunteer work done. Your chapter might have other patient care projects. After working with Melanoma No More for a year, the University of Cincinnati transitioned our work with them into its separate patient care position, and they regularly collaborate with Operation Immunization and Generation RX when we pass out informational handouts to people. Your chapter might find a project that they are very excited about. and using a chair position is a way to keep those activities going. Technology is a great way for you to communicate with others. At our chapter, we use Sign Up Genius to request volunteers through various listservs and also by asking for help at our chapter meetings. A simple enough way to recruit volunteers is by bringing a friend to your event and asking that they bring another friend too. Another important point about communication is how do you relay information with the rest of the exec committee and also patient care chairs? We have separate exec meetings and patient care meetings, but we also use apps such as GroupMe and Google Hangouts to talk, as sometimes it's too difficult to get everyone to the same place. Online communication is great with our tech-savvy generation. The biggest help that I have had as a former self-care chair was staying in touch with the previous chairs. This was the best place for me to find help. They were great at guiding me on planning and organizing events. They have answered my questions and listened to me as I transitioned to my position as Patient Care VP. And when you transition out of your position, remember to be accessible to the new Patient Care VP to help them along the way. You need to get people involved and excited about putting their in-class skills to the real world. There are barriers though. Finding a time where everyone is able to attend an event can be really difficult. Whether it's a therapeutics exam, experiential rotations, internships, or family, never expect that everyone will have the same availability as yourself to attend an event. Rather, plan events with as much advance notice as you can. This will give people who really want to attend the opportunity to adjust their schedules. Also, you don't need to limit your volunteers to just students. Faculty, preceptors, and alumni may all be interested in helping with your event, especially if you are needing a pharmacist present. Our chapter keeps a list of emails of alumni that we regularly use to ask for help. Use your patient care chairs and their committees. These are all people who are interested in volunteering in the community, and they are great resources. So you are excited about patient care, so get others excited too. Being enthusiastic about a project will make others want to join you and help you. Your excitement may even spark the interest of the person who wants to be the next patient care VP or a patient care chair. You could even get out the pom-poms for your sports-themed event. I tell all of my patient care chairs that if you didn't document it, it didn't happen. It is important to document all of your events, one, to help the person who is going to write the chapter achievement report, and two, to show everyone what your chapter is doing. I am sure that there are some amazing things in the works at your chapter, but we need to see it documented. And that could mean posting on Facebook or sending a tweet. I like to tweet our dean and the Ohio Pharmacists Association about our different events. Maybe you have a creative way at your chapter to get the word out about the awesome things that you are doing. While we are going through these pointers, if you thought of something unique about your chapter, don't forget to post about it in the chapter cookbook. That's another great way for people to hear about what your chapter is doing. Use breaks to plan as many events as you can. Breaks are a great time to organize events, so that when an exam comes up, you can focus on that rather than trying to get an event together. Also, planning events early prevents overlap between different patient care chairs and other organizations at your school that might be scheduling something. Think about what your chapter does to plan events and who is involved. Maybe a shared Google Calendar would help keep all of the events in order. Try to collaborate with others outside of your chapter. When we started working with Melanoma No More, it was only student pharmacists. Now we have medical students involved. The interprofessional involvement helps to show other healthcare professionals what student pharmacists learn in their curriculum, and at the same time, it creates relationships. You can probably think of all the lectures you had on interprofessional teamwork. Well, it's not just a word that your professors like to throw around. It is a useful tool to helping patients. With more interprofessional involvement, you will be able to have more volunteers at your events and more outreach for anything that you are working on. You can also do intra-professional pharmacy events, especially if your school has a number of pharmacy organizations. Having health fairs together will increase the bond between organizations, as we are not competing against each other for volunteers and members, but working together to improve patient care and outcomes. But most importantly, have fun. You became the patient care vice president because you loved patients. This is your passion, and this is probably your why for your position and the reason you wanted to be a pharmacist. Make sure you pick an idea that you are passionate about, as it will be fun to see it fully through. And when you have fun, you will get people excited to help you. And when people get excited to help you, it will be a lot easier to plan your awesome event. One of you will be winning an innovation award, and I can't wait to see what chapter did. In closing, thank you for listening to me. If you have any questions or comments, you can always email me from pharmacist.com. I look forward to seeing all of the awesome things your chapter is doing in the cookbook and at the annual meeting. And now back to Jeffrey.
Thank you, Nicole, for those awesome tips and tricks for patient care vice presidents. And I hope you guys really do take all of these into consideration throughout your term as patient care vice presidents. So to recap for the night, we talked about the APhA-ASP patient care projects and community outreach programs and how you can live your why through your programming. We talked about the patient care vice president roles and responsibilities, so get familiar with the patient care projects and programs, stay organized, motivate, and communicate effectively throughout the year. We talked about the resources, so keep your connections and utilize your APhA resources, including your Education Standing Committee. Reporting and awards, streamline the process, and be aware of the different deadlines of the patient care project. So now we'll talk about a couple of announcement slides. Like Jenny talked about earlier in the presentation, as patient care vice presidents and chapter leaders, it's important for you to stay connected with what's happening in APhA-ASP. So here are 4 great ways for you to do so. You can follow us on Twitter and Instagram, like us on Facebook, and also check out the YouTube channel at APhA-ASP channel. All of the webinars from Webinar Week, including this one, will be posted on that YouTube channel. So student outreach. Each fall, the APhA-ASP National Executive Committee and the APhA Student Development staff conduct APhA student outreach visits to the APhA-ASP chapters around the nation. APhA-ASP utilizes the APhA Student Outreach Program not only as an opportunity to visit the schools and colleges of pharmacy, but as a chance to learn more about each chapter's activities and how APhA can assist chapter leaders to have a successful year. In addition to assisting each chapter's executive committee and chapter advisor, the APhA Student Outreach Program is also used as a member recruitment tool for your chapters. APhA Student Outreach representatives should meet with students at the start of the membership drive campaign to share valuable information regarding the benefits of APhA membership, patient care projects, student leadership, career development and opportunities, awards, scholarships, publications, and networking opportunities available at the mid-year regional meetings and APhA annual meeting and exposition. The APhA Student Outreach Program can also provide support for existing member activities and recruitment programs. This is also a reminder. Jenny talked about MRM and the workshops we will be having on Generation RX and OTC literacy. So get excited about MRM, and you can register now. The MRM schedule is listed here with the different regions and dates for the MRMs. Each MRM also has an event page on the APhA-ASP Facebook page, so be sure to click that you are attending those events on Facebook and get more information about it there. Going along with MRM, Of course, there's the APhA-ASP proposed resolution webinars before MRM, which are conducted by the regional delegates. On here, you will discuss submitted chapter proposals and you'll be provided information on the regional officer elections and position responsibilities. There is going to be an APhA-ASP Roundtable Innovation Proposal. This will showcase the innovative, successful, and unique programs that you are doing at your APhA-ASP chapters. And if you're interested in running for regional office, which I encourage you to consider, it's a great way to serve your profession and your region. Please contact a member of the APhA Student Development staff, a National Executive Committee member, or a current regional officer if you would like more information about those positions. This slide is about the APhA Foundation. So the APhA Foundation generously supports scholarships and internships to students. So each year there are 14 scholarships offered by the APhA Foundation. And there is one, the Carl S. Emsweller Summer Internship, which is endowed by the Foundation. And there's also an executive residency in association management and leadership. So if you are a final year student pharmacist interested in association management and leadership, please check out their residency program. You can find information about that at aphafoundation.org. The last slide here is about the Joint Federal Pharmacy Seminar. So this will take place in Washington, D.C. on October 19th through 22nd of 2015, and the student programming will be on Monday. So the seminar mission is to provide a federal-focused educational and training venue, bringing together pharmacy professionals representing the federal pharmacy community. So if that's something you are interested in, you can find more information at www.jfpsinfo.org. And now we will move into our question and answer session. So I will turn things over to Samantha Lewis, who will read some questions. And again, if you have any questions, please type them into the chat on the chat bar, and we will get to them. On here. So Samantha, are there any questions?
Right now, there are no questions, so if you have any, go ahead and start typing them in. One thing that I did think of as we are going through this presentation is that it may be beneficial to explain what the CHAMP program is and how it can benefit your chapter. So do you want to kind of delve into that a little bit, Jeffrey?
Yes, I will. So your chapter leaders received an email from National President Lucy West before SLI with your CHAMP team. And what those are their small teams of different schools and colleges of pharmacy and chapters of APhA-ASP, and how you can, and it brings you guys together and allows you to collaborate on different events that you're having at your chapters. It allows you to reach out. Maybe if you have questions about how a chapter did their event, you can talk about strategies for planning and implementation. And also feel free to discuss any difficulties or boundaries that you're experiencing with implementation of your programming, and really get feedback from that CHAMP team. And they're a small group that you can should be able to reach out to with any questions you may have about programming or anything happening at your chapter.
Thank you so much. Are there any questions? I'm not seeing any. Okay, I guess there aren't any.
Okay, so if there are no questions, I have listed here the members of the Education Standing Committee. So there is Joe Alashkar from Midwestern University, Glendale. There on the far left in the picture. Samantha Lewis from the University of Tennessee Health Science Center. Nicole Clay from the University of Cincinnati. Jenny Levine from the University of North Carolina at Chapel Hill, and myself, Jeffrey Van all of their emails are here on the slides. These slides will be posted after the webinar. And if there are no other questions for the night, but you do happen to remember them, tomorrow or months from now, feel free to email any of us on the Education Standing Committee, and we'd be happy to answer them and help you out in any way that we can. That is all we have for you tonight. Thank you for tuning in.
Yeah. Hi, this is Lucy. There are a couple of questions on here, so I'll get reading those to you.
Okay, thank you, Lucy.
You're welcome. So the first one we have from Kimberly. She's asking where the OTC Literacy Initiative came about. So maybe why it was started and sort of that connection that was made.
That's a great question. So if you do remember from APhA 2015, there was a resolution 2015.2 about the proper, remember the exact title, was the proper measurement of liquid and oral dosage medications. So I can't say it stemmed from that, but it is that is something that was considered when we thought about bringing on OTC literacy, but it stemmed from Scholastic and the partnership with McNeil Consumer Health. They reached out to, and we reached out to them about partnering with them on this program because we did see the benefit and the need for student pharmacists especially to be involved in a program like this.
Very good. Our next question from Farah. May we receive a copy of this PowerPoint presentation to refer back to? I can answer this question for you. This session is being recorded. So all of the recordings of the presentations of all of the webinars will be posted to our YouTube page and on pharmacist.com. So all of these presentations will be available to you following the webinar. Our next question is, my chapter doesn't really know where to start with OTC literacy. What do you suggest we do first? It's a great question. Jeff or Jenny?
That is a really great question. And what I suggest that you do first is, if you aren't a member of your executive board, bring up your concern or your interest to your education or your executive board, excuse me, and see how OTC literacy will fit in your chapter. It may require creating a new committee chair position, and that depends on the bylaws or whatever rules or rules that you have at your chapter. So just check in with your executive board if you are not a member of your executive board at your chapter to see what that process is. If you are a member, it could be as easy as opening up a new chair position and allowing students to apply for that position or hold an election for that position to fill that position, and then you can begin the planning and implementation of the programming excuse me, for that specific project. And if your question is about programming for OTC literacy, the website for OTC literacy that Jenny said will be added to pharmacist.com within the next week or so. So look out for that. And also you can find information at scholastic.com/OTC literacy. We do have a partnership with Scholastic, and they already have a lot of resources created and available for you to use, but don't feel limited by those resources. Really get creative with your programming and how you want to reach out to those members in your community.
Yeah, I can go ahead and reiterate that for you. So similar to how we have a lot of great resources already created for Generation RX, there are a lot of great resources already available for OTC literacy. And even though you may get creative and innovative in the future, I think those are a great place to start. We will be adding a section to our website, so on pharmacist.com, specifically to OTC literacy, and it will break down all of those resources for you. And actually, we're hoping to have that section of the website go live tomorrow. So definitely look for that. And as Jeff said, that's definitely a great place to start. So our next question is another question about getting a PDF of the presentation. I would directly ask the Education Standing Committee if you have specific questions about the presentation. You can ask Jeff or Jenny, and they can get you the specific information from the presentation that you're looking for. Then we have a question here. What's the process of getting on the Education Standing Committee? So maybe Jeff or Jenny, or really any of the members of the Education Standing Committee, can answer that.
Yeah, so I will actually defer this question to Samantha Lewis. But I will say there is a deadline, there is an application process, and that deadline is December 1st, and I will let Samantha talk more about the process.
Thank you. So for the process, there is an application that you do fill out. It's very brief. You just fill out information about yourself, write a little paragraph about why you're interested in the Education Standing Committee or any of the standing committees in general. And then you also have to get letters of recommendation, so I would go ahead and seek those out if you're interested. The newer applications will be out, I'm not quite sure when, but probably in the coming months. And we can share links with you where to access it, but it is off of pharmacist.com. And the gist of it is you really need to make sure that you are that you decide like what standing committee you want to be a part of. Reach out to your advisors or preceptors and to have those letters of recommendation submitted. And I would probably have the application submitted you know, like a week or two before the deadline of December 1st. But I do know I had a few friends that waited to the last minute to ask for those letters of recommendation, so don't wait to the last minute. But it's a fairly painless process, and I always like to stress that if you apply and you don't get it this year, then keep applying. I'm one of those people that applied their second year and didn't get it, and then applied again, and I finally got it this past year. So don't be frustrated if you are not selected, but it's just an application process and reaching out to get letters of recommendation. I also would suggest reaching out to current members of the standing committees and asking what all is involved on the standing committees, just so you have a better understanding of what to expect.
Very good, thank you. So we do have a couple of more questions. First, how should I go about contacting partners or building connections with people to work with on our patient care projects when we don't have a specific date for the event yet?
That's a great question. So you can always, you can always use resources or relationships or contacts that your previous patient care vice president has set up or established, or reaching out to your chapter advisors to see what contacts they have. But when you do find those contacts and reach out to those people when you don't have a specific date, I would send an email saying how you're interested in having them at your event, explain what your event is, how they can help impact your event through their participation, and let them know kind of the timeline of when you're having the event and see when would work best for them during that timeline. So say you know you want to have an event in October, see what week would work best for them. If they're available on Tuesdays, they work all other days, they're only available on Tuesdays, what week would work best for them. So kind of put the ball in their court once you have your outline or what you're thinking of the event, and get that feedback from them before you continue planning if it's somebody that you would really, really like at your
Very good. Yeah, I think staying open with the timeline is really important. And if you're building those relationships with these potential partners, then you may be able to find dates that work better for them. And then there's maybe a better possibility of you building that partnership with that group. So our next question is, do you have to be an APHA member to participate in the patient care projects and community outreach events?
So it depends on your chapter. If you are collaborating on an event with a different student organization like SNAPA or SSHP, and those organizations are collaborating on the event, I would say no, you do not have to be a member of APhA-ASP if it's a collective, collaborative event. However, if it is an event held by APHA, just APHA, I would say that you would need members if you're doing patient care related activities, but you could always have volunteers that can help you with setup or registration, other things like that.
So technically, one of the benefits of being a member of APhA-ASP is participating in these patient care projects. So definitely, if they are doing APhA-ASP specific events, they will have to be members in order to do so. Like he said, if it's a collaboration between two organizations and you're working with your Phi Lambda Sigma chapter, and maybe not all of the PLS members are members of APhA-ASP, but that's the collaboration that you're working with, that's more understandable. But if it is an APhA-ASP event, you do have to be an APhA-ASP member to participate. So our next question is, can you be a standing committee member and an executive board member for your school chapter? This is a great question. It was asked by Lexi. So you can be in both roles technically, but both roles will be very time consuming. It's a lot of work. So we do want to make sure our student pharmacists aren't overstretching themselves and can be committed to the roles that they've taken on and that the positions that they're serving in. Especially, you don't want to take an opportunity away from another student pharmacist. Maybe there's a first or second year student pharmacist who wants to get involved on the chapter level. So if you are selected to be on a standing committee, you do want to consider maybe opening up that chapter executive committee position so that your chapter members have those opportunities as well. Being a leader, one of our jobs is to find our next successors and to make sure that the success of our chapters continues on. So it's a great experience to mentor that person and give other people opportunities as well. But technically, if you wanted to, you could serve in both positions at the same time. Let me double check to see if there are any more questions. Looks like our last question is a great question. How do we get more people to attend the events that we're planning? Sometimes we have trouble getting enough volunteers.
That's a great question. So that goes back to the motivation piece and really hitting all the different levels that I talked about on recruitment. So reaching out to different levels of knowledge of your members. So having more educational events for your first year students and more patient care centered events for your final year students, and allowing for your members to take leadership roles in the event to get them excited about the event and encourage excitement from other members.
Very good. I completely agree, that motivational piece. And sharing your stories. Share about a time that you went to a patient care event and really made a difference in a patient's life. Or maybe you have stories from the patients who can speak to how well they were served by their student pharmacists and pharmacists. I think that definitely helps in the motivation as well. All right, looks like we don't. Yep.
Oh,
There's one.
let's see. We had one question, and it was about how to submit. How does a chapter leader submit to the chapter cookbook? So you can find the chapter cookbook at pharmacist.com/APHA-ASP-chapter-cookbook, or logging on to pharmacist.com/APHA-ASP under chapter operations. Jenny showed the slide earlier in the PowerPoint. But you can submit your chapter program. Once you get to that page, there in the paragraph blurb above the actual sections of the chapter cookbook, there's a form that is hyperlinked, and you click on that form, you fill out that form, and all of that information is sent to a member of the Education Standing Committee, and we will go through them and add programs to the chapter cookbook throughout the year.
That was a great question. All right, so now it looks like we don't have any more questions. So Jeff, feel free to wrap us up here.
Okay. So like I was saying, if there are no more questions, but you do happen to remember them tomorrow or months from now, please feel free to email any member of the Education Standing Committee. That's all we have for you tonight. Thank you for tuning in. We're very excited to hear about the amazing things that you all accomplish at your chapters this year. Thank you very much. Good night.